You're live, sir, now. The meeting's live.
Devang, please start.
Okay. Good evening, everyone. Today, in this meeting, we'll be having the last session of our Invade 2022, that is the research poster presentation. Today, I, Devang Srivastav, will be the moderator for the event. Joining me as the moderator will be Ruqayya Rafi, Rotaract Simran Espal, and uh, other with him will be Shruti Kamath, who are from Rotaract Club of Medicrew and National Director for Research and Innovation. Today, we have an esteemed panel of jury with us. The first one is Dr. Rakesh Ranjak Pathak, sir. Sir did his MBBS from BHU Varanasi. Addition to his MD Pharmacology, he did MBA in Healthcare Services. Basic course of statistics in medicine has been done from Stanford University and advanced course from Bloomberg School of Medicine, Johns Hopkins University. He added to modern medicine proficiency of Sanskrit, especially Vedant philosophy, in which 18 research papers have already been published from Jadavpur University, West Bengal, to Oriental Institute, Baroda, from Punjab University, Hoshiarpur, to Dharmaram Kshetram, Bangalore, all over India. He has donated blood 54 times purely on a personal count of philanthropy. Over to you, Ruqayya.
So the other judge is Dr. Prajat sir, who is currently working as an associate professor in Department of Immunology and Public Health in Bangalore. He has 9 years of post-MD experience, post-MD teaching experience. Previously worked as an associate professor at community medicine as Deputy Kasturba Medical College, affiliated with Manipal Academy of Higher Education. 40 publications in peer-reviewed journals. He has authored a chapter in IAPSM journal, PSM textbook of community medicine. As the principal investigator, he has received research grants from organizations like ICMR and Union and National TB Elimination Program State Task Force. He has guided many students for ICMR stats and have received Best Paper Award in conferences in 9 occasions. Over to you, Devang, for the next judge.
The third and final judge who will be joining us today is a well-known person in his field, Dr. Manthappa. Sir did his MBBS from Kasturba Medical College, Mangalore, Manipal University. He did his MD, Internal Medicine from Kasturba Medical College, Mangalore, Manipal University. He is currently the Associate Professor, Department of Medicine in JSS Medical College. Sir is the author of a renowned book, Manipal Prep Manual of Medicine for MBBS students.
Thank you.
We'll be starting the events now. Ruqayya, over to you. Can you tell the instructions for the participants?
Are all the participants on board? Yeah, okay, then we'll start with the instructions. All your mics should be on and you should be audible and clear to the audience and everyone else and to the judges. And for your presentation, you will be given 5 minutes each, beyond which we would have to off your presentation. And then again, for the Q&A session by the judges, we'll be giving you 2 minutes. That's the instructions for today. Any doubts by any of the participants? So let's begin with our session. I believe first present here is with us. Jayaprakash, are you here?
Yes, I'm here. I just messaged in the group. I'll join after the second presentation. I just need to set up my laptop.
Okay. Are you ready now?
We'll skip to S. Raghav Lakshmi.
May I share the screen?
Yeah, please, Simran, go ahead. Simran, share only your PowerPoint presentation, not the screen, not the entire screen.
Actually, I've compiled them into the PDF because some of them were in PowerPoint form and some of them were in PDF form and some were in the image form.
Yeah, that's why share only the window of PDF, because the Zoom
Simran,
is interrupted.
actually, we are able to see your whole screen. When you are when you select
Yeah,
the
it's fine.
option,
It's fine now.
yeah.
Yeah, the presenter can go ahead.
A very good evening to one and all. I am Raghava Lakshmi. I'm going to present my topic as ear care among patients attending a tertiary care hospital, a cross-sectional study. Ear care is often a neglected component in ENT practice. Majority of the ear disorders are preventable and treatable with the proper ear care. Chronic otitis media is one of the important causes of preventable hearing loss. If untreated, leads to complication. Neonatal hearing screening is one of the important tools to identify early hearing loss among children in order to prevent speech delay. A main aim of the study is to assess and compare the knowledge, attitude, and practice regarding ear care, ear discharge, and neonatal hearing screening. The other aim is to raise awareness among people regarding proper ear care practices. A methodology includes first, the validator questionnaire were given to the participant of age more than 18 years. A sample size includes 323. This study was conducted during January to February 2021. After the questionnaire, handouts were given to participants, and then the data was entered into MS Excel and analysis was done using SPSS software. First, the questions were grouped into knowledge, attitude, and practice, respectively as 14 questions, 8 questions, and 6 questions. Then, specifically, knowledge questions were grouped and scored as having adequate and inadequate knowledge. Then, this knowledge questions were compared with the respective attitude and practices to find any association. These were the handouts given to the participants, both in regional and in the English language. Now, coming on to the results, in demographic details, a mean age was 41.2 plus or minus 13.8 years. We have found that prevalence of adequate knowledge is more among female and inadequate knowledge was more among literates and unemployed. Now coming on to the ear knowledge, it was found that 94.1% were unaware that ear has a role in balance. Majority were unaware that the diabetes can lead to ear problem. 84.8% knew that the common cold can cause ear problem. Overall, 82% are found to have inadequate knowledge in ear care. Now coming on to the ear hygiene, 46.2% of the people felt having wax in the ear as abnormal. And the people who practice cleaning the ear are found to have inadequate knowledge, which was statistically significant. This was the graph which we have compared ear cleaning practices with the overall knowledge. This shows that majority who practice cleaning the ears had inadequate knowledge, which was statistically significant. Now coming on to the CSOM, we have found that 76.8% were unaware that overcrowding causes ear infection. Overall, 52% are found to have adequate knowledge in this area. People who show poor attitude regarding treatment, complication of ear discharge has inadequate knowledge, which was statistically significant. Now coming on to the neonatal hearing screening, 81.7% people are aware that hearing test is compulsory for all children, and among them, majority had adequate knowledge, which was statistically significant. 48.1% were unaware of the ideal neonatal hearing screening age. Overall, 50.8% were found to have adequate knowledge in this area. Now, summing up, we have found that inadequate knowledge on ear care, ear discharge, and neonatal hearing screening shows statistically significant association with the poor attitude and practices. On conclusion, improving knowledge on this area will improve their respective attitude and practices. Patient visiting to the hospital should be taken as an opportunity by ENT specialists to impart knowledge regarding ear care and ear hygiene. These are my references. Thank you.
I request the judges to ask the questions, please.
Okay, Raghav Lakshmi.
Yes, sir.
Dr. Raghav Lakshmi, the neonatal hearing screening,
Yes, sir.
it is, whether the question is whether the patients have undergone that, or whether they want to get it done for their neonates.
No, sir. It was just a prevalence study, sir. We have this questionnaire was given to all the patients and their attenders attending the hospital, sir. So it wasn't pertaining to the patients having the ear disease or coming onto the ENT OPD, sir.
So well presented, Dr. Raghav Lakshmi. So,
Thank you, sir.
first of all, a couple of suggestions. Your introduction gives an impression that you screened people for these ear problems, but it is not so. It's more of a KAP study.
Yes,
It's
sir.
a study wherein you have assessed and compared the knowledge, attitude, and practice. So, there's a disconnect between the introduction and the objectives. And who were your study participants? Were they patients?
No, sir. It included both the patients who are coming to different OPDs. It didn't pertain only to ENT OPD and also their attenders, sir.
Their attendance as well. So that has to
Yes,
be
sir.
specified. Okay. Your title says that it was only among patients. The
Okay.
title of your study says that the study was carried out only among patients. Okay, no problem. Even the second objective seems to be incomplete. It says to raise awareness regarding what?
Regarding ear care and ear hygiene, sir.
Okay, so see, please remember that when you have written that as an objective, that has to be reflected in your results. Got the point? Please remember in future, these are some points.
Yes, sir.
Okay. And finally, what is your recommendation based on your research findings? What do you recommend?
Sir, we have to improve the knowledge, sir. Basically, people are lacking knowledge among basic requirements, sir. Still, people are ignorant about ear hygiene practices, sir. In our study, we have found that people are having the attitude that ear cleaning is safe. Nearly 60.7% have found that cleaning the ear is safe, sir. They have mentioned in their.
You mean cleaning the ear on their own self?
Yes, sir.
Okay, good. You can take this forward by carrying out further studies.
Yes, sir.
Thank you.
Thank you, sir.
Devan, can you call the next presenter?
Yeah.
Or our next
Yeah, go ahead.
presenter is Jaiprakash Gaurav. Are you ready now?
Is my audio clear?
You're audible. Dr.
Yes.
Jayaprakash.
The it has been disordered. Like, can I share my own screen?
Yeah, you can share.
Okay. Is my screen visible?
Yeah, it's visible now.
Okay. Is it visible in the presentation format now?
Yeah.
Okay, fine. Sorry for the delay. So let me start. Hello, everyone, and good evening. I'm Medical Cadet Jayaprakash Kura from Armed Forces Medical College, here before you to present my research work titled A Novel Method to Identify Streptococcus Pharyngitis Using Smartphone Images and Artificial Intelligence. Group A Streptococcus, which is also called as strep throat, is one of the most common cause of bacterial pharyngitis, which is sore throat. Now, sore throat can be diagnosed by a rapid antigen test or throat culture before prescribing antibiotics, since viral cause for sore throat is most common, which is 70%. And this does not require any antibiotic treatment. Despite of these guidelines in uh, India, uh, the antibiotics are prescribed 75% of times to patients. That is, 30 million patients out of 40 million with pharyngitis receive unnecessary antibiotic prescription each year. Antibiotic prescription is a problematic and is exacerbated with telemedicine, where doctor cannot exactly examine the patients in front of him, so they tend to prescribe antibiotics, whose reference is mentioned. This paper's reference is mentioned in my references. Now, the challenge of telehealth doctors is that they lack real-time testing for streptococcus throat for video visit. Thus, consequently, they may prescribe antibiotics without throat swab, which wastes over 22 million per year and encourages the spread of antibiotic-resistant bacteria. Alternatively, they send patients to get tested and urgent care or emergency rooms, which is time-consuming and costly for telehealth. Previous studies have established the feasibility of using machine learning methods to predict strep throat by cell phone images with an accuracy of 94 to 95%. But all these studies have been in adult patients and not in younger age group, where strep throat can lead to some serious complications like rheumatic heart disease or post-streptococcal glomerulonephritis. Now, thus, with this ideas in mind, we carried out our study with two major aims. First, to demonstrate the feasibility of AI algorithm to differentiate strep throat from non-bacterial pharyngitis using smartphone images of pediatric throats. To compare the AI algorithm to center and MASEC scores and treating clinicians' prediction to strep throat. Thus, we carried out a cross-sectional study among the age group of children 1 month to 18 years who are being evaluated for the inclusion criteria which we had. The study is still going on, but with the current sample size which we had divided them into 50% of for training of the data set, which is 116 samples. 59 images were used for validation, which is 25 of them, and 71 were used for testing of our data set. We carried out a convenient sample method, which included patients who had undergone strep rapid antigen test or strep culture, and a ground truth was defined that positive strep throat if rapid antigen or culture was positive, and a negative strep throat was considered negative. Basically a negative rapid antigen test or culture was considered a negative, and center score or modified center score, both the scoring system was taken into consideration for further validation. Our results of the AI algorithm were characterized. Okay. The outcomes were reported based on sensitivity, specificity, positive predictive and negative predictive value. Coming on to my results, 193 patients were approached, 4 declined and 5 were missing in the data. Now, as you can see with my data analysis of the AI algorithm, the positive predictive value of AI algorithm is similar to center scale with more than 80 center scale more than 3, which is 80% versus 85.5%. But sensitivity was very less compared to the Michelson center scoring system. But fortunately, the clinician, our sensitivity was much better than the clinician's prediction. And the specificity was much higher compared to Michelson and center scoring, as you can see in the as you can see in my table. Now, this study demonstrated that the feasibility of AI algorithm to predict strep throat in pediatric patients using just smartphone images. Now, the current image-based AI algorithm is comparable to center scoring and clinicians' predictions for sensitivity, specificity, positive predictive and negative predictive value, which has implications as clinicians' decision support tool. Further studies
5
will
minutes of
focus
presentations are
yes, strategies to enhance the AI performance, such as increasing the sample size and incorporating other predictive models. Thank you.
The session can be handed over to the jury.
We'll
Any questions by the jury?
Yes. Any questions?
Dr. Rakesh Rajan, sir.
Yes, sir.
say your mic is on mute, sir.
Dr. Rakesh, your mic is mute.
Yeah. Am I audible now?
Yes, sir, you're audible.
Yes, sir.
Concerning pharyngitis and artificial intelligence, there should be a false positive negative evaluation against a gold standard. How much artificial intelligence is congruent with the results of the real clinical outcomes?
Yes,
So,
sir.
any data on that?
So for defining a person with strep positive, we used two main data sets, two main methods. One was rapid antigen testing, and also using a strep culture. So if any of the rapid
That is
antigen were,
your gold standard. That is
yes,
your
sir,
gold
that is our
standard.
gold. Yes, sir, that is our gold standard, and this images were being fed, and whatever was negative by culture or rapid antigen was considered as negative, and so we treated this as a gold standard data and used 119 samples to train the data set, and then validated with around 71 samples, and then tested it with more 70 samples.
Thank you.
Yes, sir. Thank you for your questions.
Any questions from Prajitan Mathapa, sir?
Yes.
Yeah. Go ahead, Dr.
Go ahead, sir. After you, sir.
Your study has got more specificity and center score has got more sensitivity.
Yes, sir.
So I think, this next study can start from this point. You mentioned that also. You can combine both center score and
yes, sir. We can either place them in parallel or series,
so,
and then see which one is better.
yes. That center score is also very easy actually. So there are very few points. Very easy to apply bedside.
Yes, sir.
Score.
It's a 4-point scoring
Combine
system
both.
usually.
Yeah.
It's a unique study, Jayaprakash. Well done.
Thank you, sir.
One question from my side. You had 193 patients in your study, right?
Yes, sir.
Around 190 patients. They were adults as well as pediatric patients.
So in my study, they were age group from 1 month to 18 years.
Okay.
So
any information as to, did your scoring system do well in the younger age group or the older age group? Did you have any such result?
So we haven't done the stratification of data as of now because we didn't have a much data set available in age group between like 1 month to 5 years. We had a very less data set available, but from 5 years to 12 years, we had a lot of amount of data which was there with us. So we didn't do a stratification based on our age.
Stratification.
Yes, sir. So because the data set is very less to compare with the AI as of now, so the commercial AI which are available in the market have around 3,000, 5,000 data sets, but ours is much smaller. So we need to expand with that.
Thank you.
Yes, sir. Thank you for your question.
Thank you, Jayaprakash. Our next presentee is Navya Chetan Kumar Raval.
Good evening. Am I audible?
Yes, you are, Navya.
Okay. Can you present my poster, please?
Simran?
So good evening to the respected jury and my fellow delegates. I am here to present a clinical cross-section study of clinical correlation of pulmonary tuberculosis in patients with diabetes mellitus. So both diabetes and TB are actually two major diseases which have plagued our society for a long time. And this holds especially more significant with our country, that is
Navya?
India. Yes.
Navya, excuse me,
Yeah.
Navya. Sorry to
Yes.
interrupt you, but can you turn on your video, please?
Yeah, sure. Yeah. Am I? Am I?
Yeah, you can start now.
Okay. So
Yeah,
both diabetes and TB are two major diseases which have plagued our society for a long time, and this holds especially more significance with our country, that is India. WHO statistics for India in the year 2021 showed an estimated incidence of around 210 cases of TB per lakh population. And it is seen that there are 77 million people living in our country with diabetes mellitus. So in a study which was conducted in Cambridge University, in which patients with pulmonary tuberculosis and diabetes mellitus were compared to their controls, that is patients who did not have pulmonary tuberculosis and diabetes mellitus, it was found that the former had higher incidence of fever, hemoptysis, consolidation, and positive fastness on positive acid fastness on their staining. And this shows that patients with PTB and diabetes mellitus have higher degrees of morbidity and mortality compared to the other group. And this adds to the fact that PTB itself, pulmonary tuberculosis itself, is a standalone factor for high degrees of morbidity and mortality in developing countries. So the main aim and objective of this study is to find a relation between pulmonary tuberculosis and diabetes mellitus. And the main question this study wants to ask is whether diabetes mellitus is an independent risk factor in the development of pulmonary tuberculosis, whether a person who has diabetes mellitus has a higher chance of developing pulmonary tuberculosis compared to a normal person in the general population with normal glucose levels. And is there an association between the two diseases? If so, then how can we combat and how can we take this forward? So this study was completed in 15th April to 31st August 2019 in the OPD and wards of Sola Civil Hospital, Pulmonary Tuberculosis, Chest TB, and Respiratory Medicine Department. It was a cross-sectional study, and a few inclusion-exclusion criteria were taken that all the patients with both the diseases were taken for the study, and all age groups were taken under the study, but mainly people were adults. The exclusion criteria was those people who have pulmonary TB, which is intestinal TB, those people were not taken for the study, and patients with independent conditions as chronic pneumonia, etc., were not taken for the study. And it was seen in a study, all the data was collected in the form of a study performa, which included history taking of all the patients, which included biodata and chief complaints. And then after that, you have a history taking of family history, if you have any history of diabetes mellitus, if there's any past history of pulmonary tuberculosis, etc. Out of the study which was performed, certain results were obtained, and it was seen that among the 50 patients, 70% were males. There is no specific gender preponderance, but a comparative study was made between male and female as well. And it was seen that males were affected at a younger mean age group than females, but females had a higher degree of random RBS level detected and higher M3 positivity on bright field microscopy and CPNAT. But it was seen that fibrosis, which is usually suggestive of TB relapse, was more seen in males. Duration of symptoms were equal in both of them. It was seen that 19 patients out of the 50, they were not actually aware of their status. And this is one of the major factors in the study, that they were not aware of the status. And only when they came to the wards and OPD were they made aware that their diabetes levels are very high, around 300, 400 milligram per DL. And 30% of the patients did have a previous history of tuberculosis. And most of the patients actually complained about the main symptoms were cough, breathlessness, fever, night sweats, which are actually related to TB. And most of them, 95% of the patients did have any
Presenter,
alcohol,
please note,
tobacco.
4 minutes are up.
They did have any alcohol, tobacco, etc. with them. Now moving to the conclusions, diabetes mellitus is related to a significant increase in the pulmonary tuberculosis because it forms a framework for the tuberculosis to develop. And this is mainly because the diabetes mellitus lowers the immunity. The reason diabetes mellitus lowers the immunity is because it causes phagocyte dysfunction, opsonization, and chemokine dysfunction. And basically, it also causes the alveolar macrophages is the first line of defense against Mycobacterium tuberculosis. And they are not able to express their FC receptors properly in people with poor glycemic control. Thus, interferon gamma is not released and macrophage killing capability is also reduced. The main action and recommendation I would want to show through this research is that we should control diabetes mellitus and TB together. But while doing so, we should take care because these patients are on two drug regimens, that is oral hypoglycemic agents and anti-tubercular treatment. Now, rifampicin, which is given
5 minutes of presentation is over.
yes, just the last section. Rifampicin, which is given for anti-tubercular treatment, actually is a potent CYP450 inhibitor. So it metabolizes oral hypoglycemic agents that given along with it. So it can lead to hyperglycemia in these patients who are already having poor glycemic control. Plus, isoniazide toxicity can also lead to a peripheral neuropathy. Peripheral neuropathy is a specific standalone manifestation in diabetes mellitus. Thus, combining both of them can lead to a greater risk. Thus, it is very important to give isoniazide prophylaxis in such patients. And diabetes mellitus has increased prevalence. So, and it is related to causing more TB. So, if we don't control diabetes mellitus, then all the work which we have done in controlling TB holds no significance until now. So, both RNTCP and National Program for Control and Prevention of Diabetes should work together to reduce the burden of diseases on each other as well as on the society. Thank you.
Thank you, Navya. Now we have questions by our judges.
May I?
Yeah.
Yeah.
Dr. Navya? Hello?
Yes, sir.
Yeah, so your title says that it's a review of literature, but
yes,
it looks like a cross-sectional study.
Yes, sir. It's a review of literature. I mean, it's a cross-section study. So I will
kindly refrain from
that.
putting it up as a review of literature, which is something
Sure.
different. Okay. And there's no correlation. See, correlation is a very strong relationship between two variables. When you mention the word correlation, you would expect something called correlation coefficient in your result. Okay. So this looks more like association. So here you have actually screened the TB patients for diabetes. This is what I understand, right?
Yes, it's seen the correlation factor was around there was around a threefold increase with diabetes mellitus. I've mentioned over here, but I haven't said it in the presentation. Threefold increase is usually there.
And even the word impact, when we use the word impact, a cross-sectional study design will not be able to satisfy that. You will have to go for a higher. So please keep these in mind when you present next time. Okay. Otherwise, it was well presented. Okay. Thank you.
Dr. Navya.
Yes.
You include all age groups, no? Adults from 18 to whatever age, maximum.
Whatever age, yeah.
Okay, there are so many compounding factors, no? Maybe there.
Yes, sir. There are lots of compounding factors. Yes, sir. So we have
tobacco, use of tobacco, smoking, old age itself.
Yes,
so I think next time you can try to eliminate this one. As many compounding factors as possible. And you can do a sub-analysis also. Like, the diabetes control, how it was in those who had TB. And those who were well controlled and those who were not well controlled using HbA1c or something.
HbA1c, yes.
Whether it shows increased incidence in those who were uncontrolled.
Okay. Yeah.
Rakesh sir, any questions from your side?
I think to the list given by Dr. Navya with isoniazid and rifampicin, I should also add ethambutol because it causes some oculopathy, and diabetes is also related to oculopathies. They can also be related, and comorbidity can be effective in the case of ophthalmology.
Yes, sir. The color blindness.
We can add on.
Yes, sure.
Thank you.
Thank you.
Thank you, sir. Thank you, Navya. Next presentee is Esther Vas. Esther, are you here?
We can skip to the other one in the sequence.
He isn't here.
Take the next one.
Go to the next presentee, Komal Agarwal.
Good evening, everyone. Can I present my own screen?
Yes, you can.
Good evening, everyone. Myself, Komal Agarwal. I am third year medical student of Dr. Babasaheb Ambedkar Medical College, Delhi. The topic of my study is study using the repurposed drug against the topoisomerase 4 of Klebsiella pneumoniae, a potential target for inhibition. Starting with the introduction, Klebsiella pneumoniae are one of the most important microorganisms causing the nosocomial infection. It is a gram-negative, non-motile bacterium belonging to Enterobacteriaceae family. The therapeutic failure has increased as a result of the widespread occurrence of the Klebsiella pneumoniae isolates that produce the extended spectrum beta-lactamase and the carbapenemase. At the end of the DNA replication, the topoisomerase 4, which is a type of topoisomerase 2, it separates the daughter chromosome that are the topologically connected. There are the two subunits of the topoisomerase 4. One is the PAR C and other one is the PAR E. PAR C consists of 752 amino acids, whereas the PAR E consists of 631 amino acids. The computer-aided drug discovery in the conjunction with the drug repurposing is already resulting in a worthwhile possibility second medical use for the main drug. For the knowledge, the drug repurposing is the strategy to use for the new uses of the pre-existing drugs other than their existing medical uses. The aim and objective of my study is the discovery of the novel affordable drug to take care of MDR Klebsiella pneumoniae. And the second objective is the antibacterial spectrum of the G-lineated molecule can be extended to the other multi-drug resistant nosocomial pathogen for the wider coverage. The methodology which I used in this study is it is the computer-aided drug discovery. First, I started with the extensive review of literature in which we find out the amino acid which is responsible for the formation of the binding site of the Klebsiella pneumoniae. And with that amino acids, I go with the multiple sequence alignment to check the key conserved residue in the belonging species and to download the 3D crystal structure from the RCSP, which is the protein bank from which I extracted topoisomerase 4 of Klebsiella pneumoniae structure. By using that conserved residues, I formed a binding pocket in the pymol and exported a pocket in the CSAR, in which I docked with the binding site with the FDA-approved drugs. And after the getting results, drug with the minimum affinity is delineated, and 5 molecules are extracted from that according to their affinity, and which is further redocked for their inter and intramolecular clashes and the torsional stress and other properties of the drug. The amino acids which I used for the formation of the binding site, it is shown here, and the image is show the blue is show the binding site. And the drugs which is extracted after the getting results of docking, it is first is the methyl carbonyl with the lower the affinity It showed the binding with the lysine B 1000 to 113 with the bond size 1.82 Armstrong. It is currently used for the skeletal muscle relaxing. Second is the guaifenesin, which is also showed the binding with the same molecule, and it is currently used for as an expectorant. Third one is the 2-hydroxybenzoate, which is used as an analgesic under the category NSAIDs. Fourth one is the
Designator, please note 4 minutes are up.
Okay. Fourth is the guaifenesin, which uses expectorant, and to show the affinity, it is shown in the image. Fifth molecule is the zanamivir. It is used as a neuroimmunase inhibitor. It is also showed the binding with the lysine D 1113 molecule. To conclude my study, the computer-aided drug discovery is used for the in silico screening of the libraries of the approved drug molecule using the docking software like CSAR. Outcome of this study is repurposing the potential of the 4 drugs which show binding affinity against the topoisomerase 4 of Klebsiella pneumoniae. These 4 compounds are currently being used for some other therapeutic purpose. This study suggests that the new drug can be used, but their future uses in the Klebsiella pneumoniae are not well known. Therefore, we would suggest further in vitro study to narrow down the therapeutic use and the other interaction of the drug. The in vitro efficacy of these drugs can be validated with the well-characterized clinical isolates of the MDR Klebsiella pneumoniae using the standard agar diffusion assay or the MIC determination assay. Thank you.
Thank you. Now we have the question session by our judges. Dr. Rakesh, sir, any questions?
To me, this presentation is heavily impacted by the molecular biology.
Yes, sir.
But concerning the presentation, me again drug and repurposing can be made clear. Pharmacological point of view. Me again drugs are different and repurposing is a different thing. How they differ, the presenter can make clear.
Sir, repurposing drug is a strategy to use the pre-existing drug for their new uses instead of their current uses.
And me again drug, how they are different.
Sorry,
An
sir.
example I am giving, me again drug, example is methotrexate, came back for the treatment of lepra reaction. Without any further discovery, it was a chance finding that the drug methotrexate, the thalidomide, not methotrexate, thalidomide was once banned for phocomelia and now it came back in the market after 35 years for the treatment of lepra reaction. This was me again drug.
Okay, sir.
Thank you.
Thank you, sir. Any questions from Janet, sir?
Yeah, it's a very promising.
Thank you, sir.
Hello, yeah, it's a promising study. Just for the benefit of the audience, can you tell us what is in silico technique?
The in silico means the computer-aided drug discovery. Like in vitro, there is in silico. In vitro is outside the body, and in silico is computer discovery.
I have another comment to make. The last two sentences of your conclusion, those were basically recommendations.
Yes,
so
sir.
when we say conclusion, please stick to what your objective is. So your objective here was what? What was your primary objective here?
To find out the affordable drug against MDR Klebsiella pneumoniae.
Against Klebsiella pneumoniae. So you should stick to that. Okay. Maybe if you want to say that, okay, future studies are required, all those become recommendation. Okay?
Okay, sir.
Fine. Thank you.
Thank you.
And
Thank you, sir.
Komal Agarwal.
Yes, sir.
That levofloxacin drug,
Yes, sir.
that is already one of the drugs for Klebsiella.
Yes, sir. Levofloxacin is already in the market, but we can also use the drug.
Klebsiella treatment purpose.
Yes, sir. Yes, sir. But some of the data show there is a resistance against the fluoroquinolone also.
Yeah. So developing resistance, but it is one of the choice.
Yes,
Though
sir.
there are better choices.
Due to development of the resistance, I am doing this study for the new drugs. Okay.
Thank you, sir. Thank you, Komal. Our next presenter, Divya. Is Divya here?
Yes, I am here. Good evening to all. Can you please share the presentation?
Is the presentation visible?
No, ma'am.
Oh, it's not, Simran.
Okay, can I share it from my screen?
Yes, you can share, Divya.
Okay, thank you.
Please, I like to ask all the participants to please keep their videos on while they are presenting.
Is the screen visible?
No, it's not, Divya. Your screen is visible, but your presentation isn't visible.
Is it visible now?
Yes.
Can I start with my presentation?
You can start, Divya.
Okay, my topic is painless anesthesia delivery system. As we all know that local anesthesia is the backbone of the pain control in dentistry, researchers are going to further reducing pain or maintaining the less stress and less more comfort to the patient. The injection of local anesthesia is perhaps the greatest source of the patient fear, and to manage it is the most important or the significant concern for the medical practitioner or a dentist. We all know that traditional aspirating syringe, it is the most common method we can use. But also there are another recent advances such as the computer controlled local anesthesia, vibroprojectors, jet injectors, etc. So today I am going to explain one of that is the computer controlled local anesthetic delivery. The computer controlled local anesthetic delivery is nothing but the local anesthetic delivery system which can reduce pain by controlling the anesthetic injection speed, which permit at a slow speed and which can reduce the continuous administration of the small amount of anesthetic pain, not only from the resistance felt in the tissue, but also from the anesthesia taking effect simultaneously with the injection, which in turn allows the anesthetic to be injected into the tissue that has already been anesthetized. So, in computer-controlled local anesthetic delivery system, we have three types of system. That is the VAN system, the computer system, which we also called it as the single-tooth anesthesia delivery system, or the comfort control syringe, or the jet injector. The VAN system was introduced in 2007, which is the recent advance, and it is the third generation of the computer-controlled local anesthetic delivery. It has two main components, the drive and the handpiece. Here in the handpiece, there is we can control from the pain-like grasp, and it works on the principle of the dynamic pressure sensing. It has the foot activated control, and the flow rates are controlled by the computer. Thus, the local anesthetic delivered to a particular site is constant. It has demonstrated the measurable benefits as it has reduced the stress and the discomfort of the patient. So the advantages of the systems are the dynamic pressure sensing technology provides continuous real-time feedback. It allows the periodontal ligament injection to be used as a predictable primary injection. It is used for all traditional injection techniques. It reduces pain destructive behavior. The disadvantages are it is more expensive, it takes more longer time, and sometimes it is unnecessary as it produces the same result as a normal local anesthetic injection, which is delivered by a syringe. It requires additional armamentarium and requires the additional training. Another type of the computer-controlled local anesthetic delivery is nothing but the comfort control syringe. It differs from the WAN system that it has no foot pedal. It has the 5 program speeds, which are low, medium, high, very high. Syringe is bulky and it is more cumbersome as compared to that of the WAN system, and there is no meaningful difference in the ease of administration, as well as it may also cause discomfort to the patient. Another one is the jet injector. The jet injector works on the principle of the mechanical force delivered, in which the high liquid is forced to a high pressure through a small orifice. The two types of jet injectors are the Jet and MedJet H3. So the Jet accepts the standard cartridge. It permits the variable volume of the solution from 0 to 0.2 ml. It is
please
completely
note 4 minutes, Anna.
okay. It is completely autoclavable. The MedJet H3 has 7 times smaller orifice than the needle. The liquid under pressure pierces the desired layer, and it has greater accuracy, convenience, and is easy to use. The main disadvantages of the jet injector is that it can't be used over the regional anesthesia. So we don't use jet injectors. We use more commonly the cartridges. The applications of all of this is nothing but the buccal infiltration techniques, palatal infiltration, periodontal ligament injection. We can also give a single tooth anesthesia. We can also have the papillary infiltration. We can give blocks like middle and inferior annular superior nerve block, anterior superior nerve block, etc. Okay, thank you.
Thank you, Divya. We have questions from our judges. Dr. Rakesh, sir, any questions from your side?
Here we are more concerned about the routes and drug delivery systems, how the anesthesia can be applied painlessly. One more method is modification in the drug structure itself. Example is procaine penicillin. Penicillin injection itself is more painful than procaine penicillin. And procaine is a local anesthetic.
Yeah.
This could have been added in this, that modification of drug molecule can itself be alleviating the pain involved in the procedure.
Okay, sir.
As a pharmacologist, I can add this much only. Thank you.
Yes, sir.
Thank you, sir. Any questions from Dr. Prajit, sir?
Dr. Divya, what was the this one aim of your study? This one, you have done a study or some? This is a product review.
Sir, I had not done the study, but it's a kind of product review, which I had whenever I was attending a patient and whenever we are injecting from the syringe, normal syringe, there was kind of discomfort in the patient. They were shouting and screaming when we are giving local anesthetic through the syringe. But whenever we are using cartridges or the band system, the discomfort was less. and it has been reduced the stress of the operator while we are operating the patient.
Okay, you use this
We
product
don't
on
use
your patients.
Yes, sir, but we don't use this system frequently as it is most costlier, and we are in the living in this developing nation, so people don't afford that thing.
Oh, yeah, what you can do is it's like a review, product review, but you can do a study on this. Okay, those
Yes, sir.
yeah, compared to the injections, normal injections.
Yes.
So in what way it is better? How does it inject the local anesthetic? How
Sir,
does it
we
deliver it?
inject. Sir, in the band system, there is a handpiece over which a cartridge is attached, and various gauges needles have been used. But the smaller one, and it has the smaller orifice. And the more advantage of the band system is that it is all the speed of the injection, or the speed at which we are injecting the solution is computer controlled, and it has been said that whenever we have to deliver the local anesthetic, it should be delivered at the slowest stress rate as possible, so it can be controlled by the band system, which we can't do it by when we use the syringe. Sometimes it may like that we can inject it too fastly. So the time required to have the effect will be more. If we inject it at a slower rate, then we can do it easily.
Okay.
Yeah, Dr. Divya, I agree
you,
with
sir.
Mastapa sir.
Yes,
I
sir.
agree with her. It's good if you do a research and find out its effectiveness. Okay.
Yes,
so this
sir.
is more of a product review. So you can
Yes,
go
sir.
one step ahead and either prove or disprove whatever you got to know through your experiences by carrying out
Sir,
the study.
actually, the thing is that here patient didn't afford
It's not
such.
affordable. Yeah. Or maybe you could have put that as a limitation in your poster. You could have put that as a limitation that lack of affordability is one issue. Okay, and try to incorporate some references. Have they used this system anywhere else? If you come across that in the literature, maybe that could have been added in your poster as references. This is just a suggestion from my side.
Yes,
okay.
Sir. Yes.
Fine. So that would lend more authenticity to what you experienced in your setting. Okay. Thank you.
Yes.
You have compiled it
sir.
well and presented well. Thank you.
Thank you, sir.
Thank you, sir. Thank you, Devya. Our next
Thank you,
presenter
ma'am.
is Aditi.
Hello, everyone.
Aditi, cameras and
Hello, everyone. I hope I am visible and audible.
yes, you are Aditi.
Okay. So today I'm going to present my research paper, which is a study on neck pain and low back pain among undergraduate students of a medical college in Bhopal. So according to a recent study of global burden of diseases, it is found that musculoskeletal disorders are one of the major causes of disability worldwide. And development of musculoskeletal disorders at young age is a potential risk of developing chronic low back pain in adulthood. Various studies across the world have been conducted. In one of the studies in South Arabia, among the students of various professions were conducted, and it was found that musculoskeletal disorders were highest among medical students. So the main causes of this may be because they have time consuming curricula, lot of psychological stress, and sedentary lifestyle. A study at an American medical school also reported high prevalence of neck pain and low back pain, which is 54% among medical students. Excuse me. Can I move this? Yeah. So objective of this study was mainly to estimate the prevalence of neck pain and low back pain among the medical students of India, as studies in India about this is very less, and its association with the quality of life issues. Also, we tried to see whether there is any difference across the various academic years of the medical students and relation to that with their neck pain and low back pain severity. So I used, so it was a cross-sectional study. We used a sample size of around 220 students, in which we selected 55 from each batch. Data was collected from May to July 2019. We use a validated questionnaire, which included visual analog scale and Osworthy disability index, on the basis of which we analyze the severity and the quality of life issues. So according to the results, our study data showed, I'm not able to scroll it up. So according to the results, our study demographically, 30% of the students were males and 70% were females, and 35% of which developed the chronic neck pain and low back pain before joining the medical school, and 67% developed after joining the medical school. Out of 220, 108 developed neck pain, and 134 developed low back pain, and total 97 give the complaints of both neck pain as well as low back pain. So we tried to correlate various activities associated with the neck pain and low back pain. Demographically, only gender came to be significant, and which females were associated with more chronic low back pain as compared to males. Various activities were also compared, but only 3 activities came out to be significant, in which was weightlifting and doing regular physical activity and playing outdoor sports and meeting and going to parties, in which we find out that people who are more into playing outdoor sports have less incidence of back pain as compared to others. And whereas people who have more back pain, they are usually not associated with weightlifting. We also tried to analyze the quality of life issues, in which we found that with back pain, sitting was the most common complaints, and whereas in neck pain, headaches were found to be the most common complaints. So overall, the results were the more male, the neck pain and back pain was more associated in females as compared to males, and the severity, although the severity of the quality of life issues was mild according to Osworthy index, but the percentage of the students were found to be more, that is around more than 50% of the students complained of such pains. So conclusion is like there is a need to be awareness among the medical students, so that we can take the precautions initially before developing such pains, because we have to study straight for 10 to 12 hours long, and with increasing time and our medical grades, we have to perform a lot of ward works, and we have to stand.
5 minutes of presentation is over.
Okay, I would like to thank my guide, Dr. Arvind Thavle, who helped me in conducting this cross-section study, and also ICMR STS project, which approved my research. Thank you, everyone.
Thank you, Aditi. Now we have questions from our judges. Dr. Rakesh, sir, any questions from your side?
I would like to add 2 things. Very common increase in the incidence of cesarean sections. They are adding to the low back pain. The same way, the increasing mass of the breast, that is corpulence in some terminology, that is also causing neck pain and shoulder pain. So the phytoestrogens and estrogenic plastics being pollutants in our atmosphere, heavy weight breast is very common, and that is also causing neck and shoulder pain that can be referred to the back also. So these trends can be seen in the medical students also who are in the late teenage or early 20s.
Yes, sir. These can also be the risk factors, and we can conduct such studies also. We can include this thing in our research. Yes, sir.
It's
Thank
a good
you, sir.
study. Hello. Hello. It's a good study, Dr. Aditi.
Thank you, sir.
Yeah, fine. What made you use this particular disability score? We have one well-validated WHO disability assessment schedule. What made you use this one?
Sir, I used the score on the basis of the American study, which was conducted in American Medical School, which I have mentioned in my references also. So based on that, I modified the questionnaire from that study, and I added some of the questions more than that, and I used this index from that.
Okay, fine. Thank you.
Dr. Aditi, I don't know whether you can use the word prevalence, or I think a better term will be incidence. I think Dr. Prachet will be able to answer this better. Dr. Prachet, can she
Sir,
use
I
the
think
prevalence
prevalence is fine, sir, because prevalence is fine.
Okay.
Because if it was a new case, if it was newly
Okay,
diagnosed, then we can call it incidence. But here, since we do not know the onset of neck pain or back pain here, so prevalence would be apt, sir.
Okay. And one more thing I want to tell is, the neck pain. The neck pain is due to involvement of trapezius muscle. When medical students sit and bend forward, the trapezius will be the most active muscle, and it gives away very early compared to other muscles.
Yes, sir.
So, and I don't know why there is a difference between males and females. Probably explanation is these boys are more active outside, more active, and maybe that is helping them to strengthen their
Yes,
keep them more
can
fit
also
and
be one reason. Yes, but
yes.
it came out to according to the data that female were more affected, and it can also
one
be
simple
because
intervention.
females have less
One simple
vitamin
intervention
deficiency.
to prevent neck pain will be they
Yes,
should
sir.
not bend forward. They should have a head support. They should lean back and have a head support. So books can be kept on a slope on the table so that they can lean back and read, just like we read on the laptop, no, like that. There are some studies showing that position will relieve the neck pain. Okay, thank you.
Okay, thank you, sir. I'll take care of your reviews and I'll try to use it in my next research.
Thank you, Aditi. Next, we'll have Shanteja Reddy. Shanteja is not there. Okay, then Nikita. Is Nikita here? Okay, then we'll move on to Amar. Amar? Okay. Is Ashwin here? Ashwin Sharma? Okay, then we'll move on to Ankur Singla. Ankur, are you there?
Hi. Yeah.
Yeah. Can you turn on your video also, please?
Yeah, sure. Yeah. I'll just share my screen. Is it visible now? Just a sec.
Yeah.
Yes.
It's visible, right?
Yes.
So good evening, the jury members. I'm going to present my research work on reading the mind of an Indian medical student, where India or abroad. Basically, basically my topic is related to brain drain. As we are seeing these days that getting a residency training abroad has become like a critical function which is followed by migration of the Indian medical students post their graduation degree here. The international migration is not just been a global health problem, but also has some virtuous impacts like having exchange of medical knowledge, as well as it also has but it also leads to a shortage of the trained medical staff in the donor country. India has been a donor country in terms of medical students and graduates, and mostly the US, the UK, and Canada and Australia are seen as the countries that have been observed with maximum immigration rates. In this study, basically, we conducted the study on a total of 1199, that is 1199 medical students belonging to all the professional years. And we tried to include the students and the graduates from almost all parts of the country. But obviously, because I'm from the Anand Medical College and Hospital, Ludhiana, Punjab, so maximum number of participants included in my study belong to the North Indian region. But yeah, I'll come to my results soon. Before that, the main objective with which I started my study was to survey the students of Indian medical colleges to know about their intentions to train abroad. Followed by this, I also wanted to see that what were the factors or the like decision makers and which were influencing their decision in this case. So basically, what we did was that based on my colleagues, and obviously with the help of my mentor, Dr. Ashwin Bawa, we developed a survey questionnaire based on which we wanted to study the possible intentions and motives of medical students who want to get trained and educated abroad, in which we correlated the reasons or the factors which were influencing their decision to train abroad with the various demographic, socio-demographic, and educational characteristics. For example, we included approximately equal number of male and female students and graduates. Also, we tried to include equal number of private as well as government medical college students in this study. For 53.7% belong to the government colleges, as you can see here, and 46.3% of the students or participants in our study belong to the private medical colleges. So basically, because my college belonged to Punjab, the North Indian state, so maximum number of participants were from the North India region, 50.9%. But we tried to include 7.6% participants from East India, 14.6% from South India, and 26.9% from West India as well. And based on this, we started also we tried to include equal proportion of participants from all the professional years of the various professional years of medical college. So we tried to include almost an equal ratio of, but obviously we couldn't do that. So the ratio was almost like a little variation was seen among the different professional years. Followed by that, we mainly wanted to know about the decision whether they want to train abroad or not.
4 minutes, Sarah.
Okay. So basically 45% of the Indian medical graduates and students wanted to train abroad, whereas 33.8% wanted to stay back in India. We further, as I said earlier, wanted to know whether these students who wanted to stay back in India or go abroad belong to various years, amongst which we found that most number of students in their internship year, that is around 26.9% of the students wanted to the interns wanted to study abroad. That was the maximum number of students in a particular year who wanted to train abroad. Similarly, if we go number wise, the government and private medical college students wanted to train abroad were almost equal. But since more number of government college students were included in the study, so I could conclude that more percentage of private college students wanted to train abroad, and my percentage came out to be 48.5% of the students in private college who wanted to train abroad, whereas 42.5%.
5 minutes of presentation is over.
Yeah, just last 10 seconds. So basically, my results were that 45% of participants wanted to pursue their post-graduation training abroad, while 33.8% wanted to stay back in India. And the major factor that was influencing their decision to train abroad was better lifestyle and better pay grades. And UK and US were among the prime destinations, whereas 58.2% students wanted to stay back in India, and the major reason they quoted was for taking care of their parents. Thank you.
We'll move on to the questions now. Dr. Rakesh sir, do you have any question?
This is rather a preliminary descriptive type of study. There is, though they try to compare between government and private medical college, the factors they have chosen, they are statistically not that separable. They are overlapping.
Okay, sir. Right, sir. I'll take that into consideration, sir.
Because richness is a factor in getting admission in government and medical colleges, and merit. Yeah. So low merit, high richness allows people easy entry in private medical colleges.
Right, sir. Right, sir.
And this is an all pervasive issue. It is not related to single factor. Many factors are influenced by these two things.
Correct, sir. Correct, sir. Sir, we try to identify the factor which is the most influencing factor in that making that decision.
Moving on to the other judges. Dr. Mantapa sir, do you have any question for the presenter?
No, nothing, Rakesh.
Thank you, sir.
Yeah, Ankur, that was well presented.
Thank you, sir.
So you have covered a huge sample size, right? 1,100 odd, I believe.
Yes, sir. Yes, almost 1,200. Yes.
How did you reach out to these students? Was it online?
So yes, online using Google Forms.
Okay, then you could have addressed that limitation. You kept saying that twice, that majority of the students were from North India region.
Yes,
maybe if you could catch hold of your friends in South India and other parts of India like West or East.
Yes, sir.
Maybe that limitation could be addressed.
Sir, that's what I tried. I actually covered these participants from other parts of India using through my friends actually.
Okay, fine.
I couldn't increase the number anymore from other parts.
So your main outcome variable here was intention to work abroad, right?
Yes,
or
sir.
read
Yes,
abroad. The intention to work abroad.
Yes, and to know the major factors which were influencing this decision.
Fine. So finally, what were the significant factors that you found out that influenced or that had a role to play in that intention?
So the major factor here was better pay grades and better lifestyle abroad, which was reported by about 76% of the students. Also, more number of residency seats per participant, per graduate abroad was the another factor, and also some of the like low yield factors which were also a part of their decision making were workplace violence, which is seen in India.
So did you do a statistical test to prove that?
Yes, sir. Yes, sir. I didn't put all the results over here. I just put my conclusions over here because I had
that
to
was a
make it.
part of your objective, right? So at least you had listed it as one of your objectives. So
Yes, sir. Yes, sir.
would have
Actually, I
been
couldn't
better if you
include it
had-
in a poster. I couldn't include everything in my poster. That's why.
Fine.
Yeah.
So another suggestion you could add on to this by including some qualitative interviews as well. You can interview some of them, not
Okay.
many, maybe around 10 till you attain that theoretical saturation, and
Okay.
try to probe what are the reasons. So that would, give you some more value. That would be a value addition to this project.
Got
Thank you.
it, sir. Noted, sir. Thank you so much, sir.
Thank you, Ankur. Next, we'll have Ashwin Sharma.
Is my screen visible?
Yes, it's visible.
Okay. So, good evening, everyone. My name is Ashwin Sharma. I'm currently pursuing my first year MBBS from GCS Medical College. My topic for today's presentation is on-pump bidirectional Glenn shunt compared to off-pump shunt is a better influencing determinant of perioperative morbidity during palliation of univentricular heart, compilation of 2 cases. Coming to the introduction part, one of the most common surgical techniques for cyanotic congenital heart diseases is the bidirectional cardiopulmonary Glenn shunt, which is frequently performed in the palliation of single ventricular repair. The surgery is performed to alleviate volume overload. This is usually done under cardiopulmonary bypass, which is accompanied by risk and expenditures. Conversely, some authors have attested to safe health outcomes of bidirectional Glenn without CPB, which must be further investigated to suggest an optimal procedure in the clinical practice. So herein, I would like to discuss the perioperative health outcomes for the 2 cases of complex cyanotic congenital heart diseases that underwent on-pump bidirectional Glenn shunt. So now coming to the case presentation part, both the cases are presented with the complaints of difficulty in feeding. 2D echo of both the patients of both the cases revealed their congenital heart diseases and their univentricular physiology. The case 1 is 11 months old and the case 2, the age is 2 years. The gender of both the patient is male. The weight of case 1 is 7.2 kg and that of case 2 is 7.8. The duration for which the patient was put on the cardiopulmonary bypass was 83 minutes in case 1 and 68 minutes in case 2. The aortic clamp duration in case 1 was 60 minutes and the time on ventilator was 11 hours in case 1 and 26 hours, that is roughly 1 day in case 2, and ICU stay was 5 days in both the cases. Hospital stay was 13 days in case 1 and 10 days in case 2. Now, during the time of discharge, the 2D echocardiography, it revealed that there was well-flowing right-sided bidirectional Glenn shunt in both the cases and no obstruction was seen. So here I have also attached the intraoperative photograph. So here it shows that there is anastomosis between superior vena cava and the right pulmonary artery, as you can see in the figure, intraoperative photograph, and the discussion. So coming to the discussion part, here I would like to discuss the main problems of off-pump bidirectional shunt and the beneficial effects, the benefits of the on-pump bidirectional shunt. So the main problems which are faced during off-pump bidirectional shunt were difficulty in performing the surgery quickly so as to curtail the time spent clamping the superior vena cava and the long duration consequences on the brain due to high superior vena cava pressure. Also, there was a necessity to decompress the superior vena cava with temporary shunt. Now, coming to the benefits of on-pump bidirectional Glenn shunt. There was mild hypothermia during the cardiopulmonary bypass, which leads to the cerebral protection. When the superior vena cava was clamped with the CPB, minor reductions in diastolic, mean and systolic blood flow velocities of the middle cerebral artery were observed compared to the major reductions as compared to when the SVC was clamped without CPB. Also, high hematocrit in cyanotic patients gets corrected on pump to normative hematocrits as found in the general population. Anastomosis of BDG can be performed leisurely on pump, unlike when the patient was put to off-pump bidirectional shunt. Also, another benefit was avoidance of neurological injury during superior vena cava clamping. Now, coming to the conclusion part, both the off and on bidirectional gland shunt can be performed, and the results were satisfactory in both of them. But the benefits of on-pump bidirectional shunt, as outlined,
Presenter, please note 4 minutes are up.
Are a superior option for stepwise univentricular root mitigation. That is, it is a superior option as compared to the off-pump bidirectional shunt. Thank you.
We'll move to the questions now. Dr. Rakesh sir, do you have any questions?
No questions, sir. Thank you.
Dr. Manthappa sir, do you have any questions?
No.
Sir?
It's an interesting case report. Hello, am I audible?
Yes, sir.
Yes, sir, you are audible, sir.
Fine. So maybe you can take it forward. Of course, it depends on as and when you get cases in your setting, maybe you could increase the sample size later on, and that's one way of further testing whether this procedure works out, or that's another suggestion from my side. So this is there are only 2 cases. What do we call this as? Do we call this as case report or case series?
Sir, according to me, it's a compilation of the 2 cases.
Okay.
Yes, sir.
When do we do a case report? What are the indications?
Sir, when we get to, sir, I don't have much expertise on that thing.
No problem.
Yes, sir.
Okay, thank you.
Thank you, sir.
With that, we are done with all the questions, I guess. Do we have any other questions? Okay. Then we'll move on to the next presenter. Next, we have Dr. Alhad Mulkalwar. Sir, are you there?
Yeah, I'm here. I just want to share my screen if that's okay.
Sure, sir.
Yeah. So is it visible?
Yes, sir.
Yeah. So good evening, respected judges. I'm Alhad Mulkalwar, and it is a privilege to present my study in front of you. It's titled Evaluation of the Role
excuse
of
me, sir.
Manipulators. Yes.
Sir, sorry to interrupt, sir, but can you turn on your video, sir?
Yeah, sure. Yeah. So the topic of my study is evaluation of the role of Celastrus paniculatus, seed oil, or Jyotishmati in animal models of alcohol use disorder. Now, alcoholism today is a major public health concern, and the reward pathway is responsible for development of alcohol dependence, in which dopamine is the chief neurotransmitter. The current pharmacotherapy of alcohol use disorder includes drugs like naltrexone, acamprosate, disulfiram, and topiramate. However, these drugs have shown to have limited efficacy, high relapse rates, as well as high adverse effects. Now, currently, there is a drug which is known as Celastrus paniculatus, or CP, commonly known as Jyotishmati, as Indian medicinal plant, which is used in Ayurvedic practice for memory sharpening and cognitive improvement. By virtue of its suspected anti-glutamatergic and anti-dopaminergic activity, it is proposed to have a role in the treatment of alcohol use disorder as well. The objectives of this study were to evaluate the effect of Celastrus paniculatus, in the animal models of alcohol dependence, to check its anti-craving effect, to evaluate its mechanism of action, and to check its effect as an anxiolytic drug. Now, this study was divided into 3 parts. In part 1, the conditioned place preference, or the CPP model, was used to check the effect on alcohol dependence. In part 2, the alcohol deprivation effect model was used to find out its mechanism of action. And in part 3, the effect of Celestis paniculatus as an anxiolytic was checked using two animal models of alcohol withdrawal induced anxiety. Cold milk was used as the vehicle for oral administration, and test of normality was applied to the data, which was further analyzed using one-way ANOVA test and post-hoc Tukey's test. Now coming to this first animal model, which is the Celestis paniculatus model for condition-place preference. Here, we see that all the 3 CP groups, as well as the standard control, which is naltrexone, significantly reduced the mean difference in time spent in the alcohol preferred compartment as compared to the respective control groups. All the doses of CP showed comparable results to the naltrexone group, and Celestis paniculatus also showed a dose-dependent effect. Coming to the alcohol deprivation effect, or the part 2 of the study, here we use 2 antagonists, that is daclopride, which is a dopamine D2 autoinhibitory receptor antagonist, and D-cycloserine, which is an NMDA receptor agonist, to check the mechanism of action of Celestis paniculatus. The rats were deprived of alcohol for 15 consecutive days, wherein water was the sole fluid available to them. The test drugs were administered during the phase of deprivation. At the end of day 15, alcohol was again introduced and its consumption was recorded 60 minutes later. It was found that the animals in the CP group consumed significantly less alcohol as compared to the vehicular control group. The alcohol intake as well as the percentage preference for alcohol was significantly less in the rats which were administered CP as compared to those which were administered CP along with raclopride or D-cycloserine, which indicates that these drugs could successfully reverse the action of CP, and thus CP can be said to act by the glutamatergic and dopaminergic pathway. In part 3 of the study, we used 2 models, the elevated plus maze and the open field test. The elevated plus maze test consists of 2 open arms and 2 closed arms which lie perpendicular to each other in a plus shape. The mouse was placed at the center of the maze and was allowed to explore it for a period of 5 minutes. The time spent by the animal in the open and closed arms was then recorded along with the total number of open arm entries as well as the percentage preference for open arm. The rodent's natural preference for protected areas, that is the closed arms, is reinforced by anxiety, and thus greater the anxiolytic effect of the drug, more would be the time spent by the mouse in the open arms. Similarly, in the open field test as well,
4 minutes, Sarah.
yes, the mouse spent more time with the mouse which was given CP, spent more time in the central zones as well as had more number of crossings of the central area. Thus, to conclude, Celestis paniculatus has showed a dose-dependent effect and dose-dependent activity in animal models of alcohol dependence. It also showed an anti-craving and anxiolytic effect compared to naltrexone and diazepam respectively. The anti-craving activity of CP seed oil was found to be as a result of its dopaminergic and glutamatergic pathway actions. Thus, CP oil could be a promising alternative or an addition to the existing pharmacotherapy of alcohol use disorder. To further substantiate this hypothesis, we are currently working on other animal models to evaluate the effect of Celestis paniculatus on the exact neurotransmitter levels in specific regions of the brain, such as the prefrontal cortex, the striatum, and the midbrain, which would give further molecular level evidence in the regard of CP being an excellent agent as an anti-craving, as an anti-relapse, and an anxiolytic agent for alcohol withdrawal induced anxiety in the treatment of alcohol use disorder. Thank you.
We'll move on to the questions now. Dr. Rakesh, sir, do you have any questions for the presenter?
Concerning this alcohol abuse, there are many drugs which are used for alcohol addiction alleviations. One of them is Madhunashini. Have you come across that? Madhunashini.
Yes, sir. We have come across that. Actually, the entire department is working on different drugs for alcohol use disorder. I chose this particular drug after doing.
You have chosen Jyotishmati.
Yes, sir, Jyotishmati. Because it has
and
shown a lot
I am
of.
talking about Madhunashini.
Yes, sir. I am aware of its potential implications in the treatment of alcohol use disorder. However, its mechanism of action or exact molecular details I am unaware of, sir, at this point.
Okay, thank you.
Thank you, sir.
Next, we'll have questions from Dr. Manthappa, sir.
This study was conducted in how many was this one in control group and this one test group?
Yes, sir. So the total number of mice and rats in each group was 8. And in the entire study, the part 2, which is the alcohol deprivation effect, was done using rats, while part 1 and 3 were done using mice, depending on the requirements of those particular models. And each group had 8 rats or mice, which were found to be adequate using the Paget and Burns formula. And even the doses were calculated accordingly. 8 rats and mice in each group. So each group, which are the study groups, which can be seen on the screen, there were 6 study groups, 5 and 6 respectively. So total number of 144 mice and 64 rats were used in this study.
And why this raclopride and D-cycloserine, why it was administered?
Yes, sir. So in the phase 2 or the part 2 of the study, we wanted to find out the mechanism of action. Now it is hypothesized that it works via anti-glutamatergic and anti-dopaminergic activity. So we gave dopamine agonist and glutamatergic agonist to see whether a co-administration of Silastus paniculatus along with these drugs does the effect of CP reverse. And if you can see, sir, the alcohol consumption was increased. So the effect of Silastus paniculatus was reversed by these 2 drugs, which gave us the idea that yes, as hypothesized, it works via dopaminergic receptors, D2 autoinhibitory receptors, and NMDA glutamate receptors. So for mechanism of action, we had chosen these 2 as the agonists in the group 5 and group 6 of part 2, sir.
Okay.
Thank you, sir. Rajesh, sir, do you have any questions?
Yes. So were you able to fulfill all the objectives of your study?
Yes, sir. So as the objectives in this case were to evaluate its mechanism on alcohol dependence, effect as alcohol dependence as an anxiolytic agent and anti-craving effect along with the mechanism of action. So for this, which was the phase 1 of a larger study, I could finish all the objectives and all the results we could present. The second part of the study includes molecular level analysis in the rat brain or the mice brain to find out using chromatography, liquid chromatography, how the neurotransmitter levels exactly at a molecular level have been affected. So that we are currently doing it, currently performing it. Yes, sir.
Fine. So you did a randomization procedure, right? For the
right, sir. There were we also did matching according to the weight, according to the sex, and according to the baseline alcohol consumption. So they were matched accordingly, so that does not remain a biasing factor, sir.
So were you asked to register this in the CTRI database, Clinical Trial Registry of India?
So actually this comes as a preclinical study. So this comes under, so we were not required to do it under clinical trial registry.
Good. That's a good study. Well done.
Thank you so much. Thanks a lot, sir. It was an honor to present in front of you all.
Thank you, Dr. Alab Halwar, sir. Over to you, Rukaiya, now.
Now we have and Rajesh sir for the presentation with their knowledge. I would like to also thank all the presentees for their contribution and exciting decision. A small announcement for the presentees.
Rukaiya? Okay. Thank you so much, everyone. Those were some great presentations. Thank you so much for participating. And thank you so much for the juries who took out the time from their busy schedules to come up here and judge the presenters. With that, we come to an end of this presentation competition. And this was the last competitive session of our Invade 2022. Thank you everyone for joining us today. Thanks a lot. We can end the session, Lavina. Lavina? Simhachalam sir?